Hello everyone, Dr. Taylor Levine from Unruh Spine Center, where today I'm going to be going over some conditions that you may not know myself as a chiropractor can help you with. I'm going to not only talk about how we can help you deal with some of these issues at home with some stretches and exercises, but I'm going to give you a glimpse of what some treatments may look like if you come into office dealing with these conditions. A condition that I often have patients come into my office for is shoulder pain. And shoulder pain can present itself in a few different ways. Some people deal with shoulder pain in the front, some people deal with shoulder pain on the side, some people deal with shoulder pain in the back. When people are dealing with these shoulder issues, it could be from a multitude of things. It could be that they're dealing with their labrum, which is something that holds this ball into the socket here. Some people can be dealing with point tenderness pain right over particular areas. These conditions, there are certain tests that we'll run or potentially images to find out what you may be dealing with, and that way we can lay out a course of treatment that suits you best. Some common conditions that you may Google and find that you may be dealing with and what we'll be able to help you diagnose is bicipital tendonitis, rotator cuff tendonitis or strains, bursitis, or dealing with some partial labral issues. Some of these conditions present in multitudes of ways, and that's why it's important that you come in and get evaluated to see what sort of care is going to be specific for your needs. So depending on your condition, it may be a great benefit to you to use a massage gun on your shoulder injury. Now, if you're dealing with a lot of tenderness and tightness in this front part through here, I'm going to talk to you about how to kind of work that area without aggravating it, but also show you some different points to hit to help loosen up this shoulder as far as some at-home treatment. So when we're working on this front area here, you definitely want it on a lower setting and quickly just moving back and forth in this front part of the shoulder here. If it gets too tender while you're working through it, then you should back up and work down the arm just a little bit and slowly go back into that center point of that shoulder. Now, if you're dealing with discomfort in this side part of the shoulder, it may be coming from not only the muscles that attach in this part here, but it may be stemming from the back of where your shoulder blade is that attaches to this area. So this is another great area to work right through the back of where your shoulder blade is. And if you find those little tender spots, especially in this back area, you can hold over that for a little bit to ease some of the tension. And of course, we can't forget our big trap muscle, which everyone has super tight trap muscles that we would work this area to relieve more tension along that shoulder and that shoulder blade area. So working the massage gun will definitely help as far as your discomfort that you're dealing with in this shoulder. But also I do recommend getting some ice over this shoulder. And if it's more so in the front, focusing more on the front. If it's more in the back, you can put that ice pack on the back. These are a couple great things that you can do to help mitigate your discomfort at home. As well, one thing to look into doing as well at home or whether at the gym is to work on not only stretching that shoulder, but also working on strengthening that shoulder to give it the support it needs to help make sure that this pain that you're dealing with doesn't come back again. I have various different types of stretches and exercises on my social media platforms, either on Instagram or on YouTube, that I implore you to go look up and do those at home. Again, I'm Dr. Taylor Levine from Unruh Spine Center, and if you're dealing with this condition, please call my office and make an appointment. We'll get you evaluated and figure out what your best course of care is. We'll talk again soon.